Thank you for everyone that's joining for your lunch. Just a little about me. My name is Patience Gbafa. I am the cancer epidemiologist with the Nevada Central Cancer Registry. As an epi, I study the distribution and determinants of cancer within our population here in Nevada. Um, and this is done through use of registry data to identify risk factors, track the spread of cancer, and provide insights through reports. And this is all done to better lead prevention and control measures of cancer. So, with that little introduction, let's go ahead and get started. Um, okay, so thank you for again spending your lunchtime with us today. I will go a little bit faster. We will be covering many topics. And they include, the welcome and introduction, history, data collection, um, all the way down to future plans and goals. And then we'll, of course, have a moment for any questions and a discussion if anyone has anything they'd like to add. So, the Nevada Central Cancer Registry is a vital statewide population-based resource that serves as a cornerstone for assessing the cancer burden in Nevada. It was established in 1989, and we've been dedicated to collecting comprehensive cancer incidence data. Since 1995, we've received funding from the National Program of Cancer Registries, NPCR, through the CDC, and it's helped our registry's efforts and our operations. So, our ODS, our oncology data specialist team, spans between Carson City, Reno, and Las Vegas. I'm in Las Vegas. We have a program manager who is Andrea Gucci. She wanted to be here today, but she is on maternity leave. She ensures the program meets its objectives, stays within budgets, and everything that a program manager does. We also have a business process analyst who's the person that focuses on optimizing workflows within the cancer registry. We have a biostatistician. As you know, they crunch numbers. They design studies, analyze registry data, and interpret statistical outcomes. We also have a health program specialist role, and it involves developing and implementing health programs based on the data from the cancer registry. They might work on public health initiatives, educational campaigns, and policy recommendations. Our oncology data specialist is responsible for accurate collection and entry of cancer-related data into the registry. And they do work closely with healthcare providers, like maybe some of you on the call today. Our administrative assistant supports our entire registry team, handling day-to-day administrative tasks like scheduling meetings and managing communications and maintaining records. And lastly, the cancer epidemiologist, which is me. As I said a little earlier, I study distribution and determinants of cancer within the Nevada population. And I also represent the registry at public stakeholder events and give presentations like right now today. And let us continue. So our cancer registry has had many successes as an organization. Before I go into this, just for some background, in 1997, the North American Association of Central Cancer Registries, or NACER, instituted a program that annually reviews member registries for their ability to produce complete, accurate, and timely data. So annually, NACER will review data from these registries, and after they assure the quality and accuracy based on predetermined objectives and independent registry certification criteria, they will award silver and gold recognition. And this year, our cancer registry did achieve silver registry recognition, which you could see on the left of your screen. And on the right, the blue map is showing the states that have been recognized for survival and prevalence. And you'll notice that Nevada is in blue. So that means that we've achieved NACER's certification and fitness for use in survival and prevalence data, which is a great accomplishment. And it shows the months of diligent effort that our staff at our registry has put in. The cancer registry collects cancer data from multiple sources, and they include hospitals, medical labs, screening facilities, and healthcare providers that are involved in cancer diagnosis and treatment. The cases are meticulously abstracted from these medical records, and we ensure compliance with state reporting requirements. This data that we collect goes through validation and editing processes, of course, to maintain accuracy and completeness. And then we also get data, might not be mentioned on the screen, but we do get data from non-hospital sources like death certificates and pathology labs. And every year we electronically submit cancer data to the CDC's National Program of Cancer Registries and NACER for analysis and certification, like we just talked about our silver registry status and inclusion in national cancer statistics. So many of you may be familiar with Web Plus because if you record your cancer cases, this is where you would record it so that we can receive them. You can also use your hospital EHR system. So once you get to this website, you would log in and go ahead and do your case entry, including patient information, like demographics of age, gender, etc. Diagnostic details, including cancer diagnosis, type, location, and stage, and then treatment information. So a documentation of all surgeries, chemotherapies, radiation, and other information. So Web Plus then performs a real-time validation check on the data, and it will flag any errors or inconsistencies. And after ensuring all data is accurate and complete, you or the facility would then submit the case, and our cancer registry would get that case. Facilities also can review and edit submitted cases if it's necessary, and this ensures ongoing data accuracy. And so by following these steps, that's how healthcare facilities can report cancer cases to the registry, which helps contribute to the comprehensive cancer surveillance and research. A little more on reporting. I mentioned earlier that the reporting of cancer is required by law, or at least I think I mentioned earlier. Our statewide cancer registry is regulated by both Nevada revised statutes, and those regulations are adopted by the State Board of Health. So the statute mandates that the reporting of cancer in the state of Nevada comes to the registry. And the Nevada Administrative Codes provides authority requiring hospitals, pathology labs, and freestanding cancer clinics, and anyone who works with cancer patients to report these cancer cases. The reporting requirements for each case are listed here on the screen. So we have hospital-specific information, patient information, demographic information, all the way to patient outcomes. I'd like to mention that in the near future, the Nevada Cancer Registry will no longer be accepting paper submissions, and we will go over this a little further into this presentation. So the Nevada Central Cancer Registry plays an important role in measuring cancer incidence and supporting various initiatives, including comprehensive cancer control, health disparity reduction, and advancements in prevention, diagnosis, treatment, and survivorship. We also actively contribute to cancer-related research efforts. Our registry is funded through the CDC grant. You can see the grant number right there. And the grant does support our operations and enhancement of Nevada population-based cancer registry and promoting the use of our data. So speaking of our data, we've already gone over how you or places share their data with us. We have publicly available cancer data, and I will share that in the chat in a little bit, but it is a dashboard and the cover of it is here. The dashboard is available to anyone who would need it for personal or business use. The public can get data straight from the source because all the data provided on this registry is from the Cancer Registry as well as the Office of Analytics. So it allows you to access comprehensive cancer data and trends both in different counties, but also it can be broken down by different demographics as well. If you need any data, this will be your first source of information, but I will tell you about a second way of getting data right after this. Some common challenges and opportunities within our registry includes data accuracy and completeness and technological and operational challenges. For example, sometimes we do get cancer cases reported to us that are missing information like gender or just small details that just were overlooked and were not put in. We also have opportunities for improvement to improve our reach within the state. And this includes new technologies and methodologies for data collection and reporting, as well as collaboration with other organizations and stakeholders. So this includes people who want our data or anyone who wants to collaborate with us. We're always happy to help and happy to participate. So back to data, you can request more data. It's actually as simple as filling out a data request form. You might need more data beyond the dashboard for research purposes, grant applications and funding proposals, maybe for planning and routing community services. I will share this with anyone who's interested. You can request more data by downloading this data request form on the screen and filling out what the data is being used for and all the questions that are listed on it. It's not super long. After you complete the form, you can then attach it in an email to data@dhhs.nv.gov. And please, if you do this, please make sure to CC Andrea or me. I will share our emails towards the end here, and we will help you get the data that you need. So we have many healthcare providers and partners, and they play a role in the success of our registry. Their number one responsibility is accurate and timely reporting. So on the right, you will notice a timeline breakdown showing how much time there ideally should be between a patient encounter and a reported case to the cancer registry. So for example, if the patient encounter happens in January 2023, the case should be reported to the registry by July 2023. This timely reporting helps support the registry's mission to support prevention and treatment. We also provide many training opportunities. The one highlighted here is called FLOSSY, or the Fundamental Learning Collaborative for the Cancer Surveillance Community. And it's Nevada's go-to learning management system. So Silver State registrars can access these CE eligible courses for free. And if you are interested, you do have to have an account. And anyone interested, I will go ahead and provide the link to making a FLOSSY account. We do also have Nevada cancer reporting manuals, and it is online on our webpage. Happy to share that as well. And any other information that you may need that maybe isn't on our page, please feel free to contact us at the email right there, dpbhNCCR@health.nevada.gov. So, as part of our data modernization initiative, the CDC's National Program of Cancer Registries is developing a new computer system for central cancer registries. It is cloud-based, which just means it's on the internet. And the new system, which enhances and builds on what central cancer registries already use, is being tested in a few states right now. So it will allow cancer registries to collect and edit and store cancer data more efficiently. And you can find out a lot more about this online on a CDC website that I, again, am happy to share. I just can't find the chat right now, but I'll be happy to share any of these resources with you. And as for electronic reporting, this is in compliance with the CDC initiative, which is why our cancer registry will soon be moving to electronic reporting only, and we won't take any paper reports or PDFs. This is a new industry standard require or is requiring cancer registries to become part of the standard. There are many benefits to switching to electronic only reporting, and they include better coordination of data activities and systems across agencies, a faster evaluation of cancer control strategies, and improved program planning, easier data collection for partners, which everyone loves, and a more timely adoption of new technologies for collecting and using cancer data. So I would like to take a moment to recognize our external partners that we collaborate with. We do collaborate with universities, specifically UNLV, UNR, and Touro University. We supply them with Nevada cancer data for research purposes. We also collaborate with Nevada Cancer Coalition, who we're collaborating with now. We give them our data from our registry so that it helps them develop their 5-year Nevada cancer plan. And with that data, they can define priority areas in cancer control, identify evidence-based strategies to decrease cancer incidence and mortality, and better direct public health dollars. Lastly, we collaborate with NACER, who I've mentioned a few times in this presentation, the North American Association of Central Cancer Registries. They use a virtual pooled registry cancer linkage system, or some of you may know it as VPR-CLS, and it's a single location to facilitate the timely access to high-quality cancer surveillance data for minimal risk linkage studies. So basically, that means that researchers need data from registries, and we're just helping them get that data in a streamlined process. As we are ending, I'd like to highlight some of our registry's future goals. We have a goal of continuous improvement, as any good organization does. We continually strive to improve data accuracy, data completeness, and timeliness of reporting. We also have a goal of more technological integration. As I've mentioned several times, we will soon be making the move to electronic reporting, and we want to implement new systems to do this well. We also want to strengthen relationship with stakeholders. We strive to maintain strong relationships, and we do this through educational offerings and presentations like this one, which helps to promote collaboration and information sharing. Lastly, we have current and future goals of collaboration. We're committed to attending and participating in available stakeholder meetings or advisory meetings where people would like to give us feedback, and we would like to gather feedback, address any concerns, and solicit some input on our data quality and data quality improvement strategies. So in closing, I just want to remind you of a few key points. Cancer registries are very important in measuring cancer incidence and supporting various initiatives like comprehensive cancer control, health disparity reduction, and advancements in prevention, diagnosis, treatment, and survivorship. Accurate and timely data collection is super important with our partners, some of which I hope are here today. This is crucial for us to do the work that we need. And please remember that our data is available. It's available on the public cancer dashboard. Um, but of course, if more data is needed, you can request data that goes beyond the dashboard. With that said, thank you for spending a quick lunch with us. And I do think we might have a little time for any questions that anyone might have, but thank you so much. And this is Andrea's contact information, including her email and cell phone, and then mine as well. If anyone wants to reach out for further information or you have any questions.
Patience, thank you so much. That was such a great overview of the registry. I have been dropping all of the links that you were saying that you would share. I've
Oh,
shared
goodness.
all into the
Thanks.
chat as you were talking, and I'll make sure that those go out in the email that everyone gets afterwards, so that they don't have to hurry and copy all those links down. Um,
Okay.
so we don't have any questions in the Q&A yet. If anyone has a question, you can drop it in the webinar chat or drop it in the Q&A. I'm going to ask a quick question just to kind of kick things off. So um, obviously you said that we collect treatment data on cancer cases. How detailed can that data be? For example, if a physician does biomarker testing on someone's tumor, or someone has genetic testing to determine if they have the BRCA gene, or they test positive for Lynch syndrome. Would that sort of information be within their case data?
I think it depends on the question asked. Like, when well, I don't think you put in cases, but when people put in a case for us to see, I think it depends on what is asked. I don't know if you remember earlier, I said sometimes people skip questions or they don't give information that is needed. But for this specific question, I actually don't know what is asked because I don't collect case data. Someone from a registry would be better equipped to answer that question. And if they are here, feel free, but otherwise, I can get back to you on that.
Let me see if I can. I just allowed Rainey to talk if she wants to unmute and answer that question.
All right. Had some problems with Zoom earlier, so can you hear me?
Yes.
Okay. Um, so every year, as treatment modalities, um, come about, every year we update our data set to include new fields, to new variables to track. And so I do know that there are biomarker variables available, but I'm not sure what they are. It would be an ODS question. They know that treatment data way better than I do. I move files and do database work, but so I do know certain fields are available, but it all depends on whether we are able to obtain that data. We'd love to work with more oncology and radiation providers to get better treatment data. So we are working on onboarding, to more electronic format and get people off paper reporting, because we are not getting complete information on a lot of that paper.
Do you think that the web reporting will increase the completeness because it will kind of make it a more, I don't know, I guess simpler process? It'll be more integrated into their systems.
Well, it's kind of what Patience was talking about. If there is a variable and it's not filled in and an edit fires and says, hey, this needs to be filled in, then, we're more likely to get it than if they are filling out a piece of paper and then attaching a bunch of test results, pathology reports to it. which is what we get right now in those PDFs. Yeah, I think that it would improve the
So it sounds like the web-based reporting really is going to help with our data completeness overall.
yes, yeah, definitely. We'll be able to get the case sooner and be able to evaluate it and process it, and it not sit in a queue for one of our ODS staff to data enter it, you know. And it takes a great amount of time. It takes the entire year to input a year's worth of data, of paper, you know. So that delays, that data coming into our data system, waiting for it to be data entered. Now, even if, the outside facilities were to, if say that, there's not a registrar in most, doctor's offices, but, they could put in the demographic information and the high level cancer data and then copy and paste things into the text boxes where, the case is already started and it doesn't take so long for the ODS staff to process it and get it into our main database. So, yeah. And then also, there's opportunity to get electronic reports through HL7 from facilities, but only if their EHR is certified with the ONC. It's part of the Health Information Technology group. But, an EHR has to be certified to report electronic cancer cases. And if it's a smaller group, maybe they have a certified EHR, but they haven't purchased that cancer reporting module. It costs money. Maybe they have 100 cases a year. Is it worth spending that money to make that electronic connection in HL7 where their EHR is automatically sending records to the cancer registry with no staff intervention, built-in case finding, and then it just sends the case. So, we'd like to expand on that. And we do receive, like all scripts, EHR. If the practice has that module, then they can work with their vendor to set that electronic reporting up. But it does take staff time, and it just depends. It would be nice to have those larger providers on that method, but it takes time to onboard and get it going. Testing takes a while.
So it sounds like there's a lot of opportunity. So hopefully we will be able to keep moving towards integration and kind of getting our technology up to speed so that we can get our cancer data even more robust and hopefully use it to continue our work. Are there any other questions? I don't see any in the chat. Just give one more minute in case anybody has a question. So patients, can you talk a little bit about what you're working on for the cancer plan with the registry and data?
Yes. Well, right now I am working on a work group, with the Cancer Coalition, but that's more for data. But for the registry, I am working on a lung cancer report. As I'm sure many of you know, this is Lung Cancer Awareness Month. So we're trying to get this report out about what may be causing high incidence rate, what we can do as public health people to lower that rate as well as lower mortality. I'm hoping that this report will be available very soon, this month. And everyone will be able to read that. But lung cancer screening, big thing right now. Um, Huge part of the report as well. If you can get screened, but yeah, that is what I'm working on right now with the registry. So
And then what's your next report after lung?
I it's not related to cancer.
Oh,
I'm working on other disease reports that are more communicable. But after lung, I know there's something I couldn't tell you right now. I don't remember, but there will be something, and it will hopefully be published and out in the public for people to read and get more information about.
fantastic. I know it's had been a while since we had gotten cancer data reports simply because we didn't have an epidemiologist on staff. So we're so excited to be getting those again and to have those really being shared with our community. So thank you for thank you for doing that and thank you for working with the state. And um, I don't see any other questions. So I'm going to once again apologize for being late because that's what it was. And appreciate everybody joining us. We're going to post a recording of this online, and I will make sure to get all of the links out in the follow-up emails so that if you have any data questions, you can reach out to patients or search on the website.
Thank you.
All right.
I know it was super fast talking as well, so please feel free to please reach out. Thank you.
Thank you so much, everyone. Have a great day.
Thank you.